Hello everybody, Dr. Carlo Ojeda, board certified emergency physician with DrER.tv. If you're listening to this video or audio, you are at ED Exit Video Pro, which is a channel specifically for the healthcare enthusiast who wants to learn medicine, whether you be a student, nurse, paramedic, or a young resident, or even a physician who just wants to catch up and see what else is out there, what we can learn from cases like this. So, this patient presented to the emergency department with abdominal and groin pain. And this is the picture of the CT scan where he presented. And I'm not going to talk about it too much right now, but we'll do it in the next picture after we learn about the history of the patient and stuff. So this is a 20-year-old male who presented with left testicular pain for, 2 years. So even though it's been present for 2 years, all of a sudden it is a medical emergency. They show up in the emergency department because now it's not just the testicle, but he's having abdominal pain for the last 2 months. The doctor says, well, what made you come today? And the patient said, well, my mom said my stomach is getting bigger and I should get it checked out. So this is what you get when you don't get checked out promptly. If you look at the groin, you see the most evident thing is this big mass in the testicular area. It's a big testicular mass, possibly cancer. And the reason he's hurting his abdomen is because his abdomen also looks very abnormal. If you look at his whole abdomen, it's filled with this area, which is probably mass as well. So, lesson to learn is do not ignore symptoms. I mean, 1 day of an ache in your testicle, okay. 2 days, 3 days, you got to get it checked up. I mean, I'm not saying run into the emergency department, but definitely get it checked up. This patient probably has testicular cancer, and it propagated, now it's in his abdomen. So it's going to be much harder to treat. Probably need a debulking surgery where they remove most of this tumor out. He's going to need radiation, chemotherapy, and everything. And we don't know what the chance of survivals or anything like that is. But this is just a very sad case, a case of a patient not taking symptoms seriously or being too scared or too timid to tell somebody about them. It wasn't until his abdomen got distended and grew that the patient showed up in the emergency department for evaluation. And sadly, it's probably very late when he could have been treated much simpler, much easier earlier in the disease. So I think this is a very important case to kind of go through because I've never seen anything like this. I mean, look at that growing mass present here. It's just humongous and obviously extending into the abdomen. That huge mass in his abdomen looks, nice and distended from it. So that's it for today. I wish I had more details on the case, but I just thought that even with a little bit of details I have, it was worth discussing and going through it. So that's it for today. We'll see you in our next video. Bye-bye.